I really respect the fact that doctors have gone through intense training for so many years. But there are times where I show up to a doctor's office and I've seen them Google my disability right in front of me, which is a reminder that you don't know everything.
Welcome to Disability Clinic, where disability gets demystified. I'm your host, Dr. Stephanie Van, a pain and function specialist who's consciously working to be a disability accomplice. I'm a Vietnamese female with long black hair wearing a navy blue sweatshirt that says, "Disability is not a bad word," against a blank white background. I'm also wearing a Judy Human t-shirt with a quote that says, "I want to see feisty disabled people change the world." But enough about my wardrobe. Joining me today is my honored guest. She's a disability rights activist, writer, and podcaster whose new book is called Demystifying Disability: What to Know, What to Say, and How to Be an Ally. Please welcome Emily Ladau.
Woo! Welcome to the show, Emily.
I love the one woman cheer section. Hi, I'm Emily Ladau. I'm a white woman with brown curly hair and a ponytail. I'm wearing a maroon and white striped shirt and I've got black rimmed glasses. My background behind me is blurred by the magic of Zoom. And I am so excited to be here today.
I really appreciate you coming on the show. And obviously, we both know you're very well known in the disability community, but there's still a lot of people out there who may not know how awesome you are yet. How do you usually introduce yourself to people who don't know anything about you?
A little bit about me that you can't see in the screen is that I am a wheelchair user. So I often like to make the joke that I am a professional disabled person. I'm disabled 24/7 in my personal life and in my work life. But in all seriousness, I introduce myself as someone who is a passionate communicator, educator, and storyteller when it comes to talking about the disability experience.
That's another cheer moment right there.
I do quite a bit of speaking, but I've only done a little bit to people who are in the caring profession. So I've done a lot of occupational therapy, I think some physical therapy, occasionally med students, but I don't see as much of a focus as I would like to in academic and medical spaces dedicated to having these kinds of conversations.
That was actually one of the questions I was going to ask you is how often have you been invited to speak or educate healthcare professionals, specifically doctors? I guess that's where I'm coming from.
It's funny, not as much as I would like. I really feel like there is a gap in these conversations in those spaces. Right now, I'm seeing the interest in corporate spaces, in educational spaces, in academic settings, but not in the medical school and the training spaces.
I feel like there's this attitude in healthcare. It's like, oh, we already know everything. Like we're already very educated. There's nothing anyone can teach us. And I just feel like that attitude is so ingrained in the healthcare culture, but it's also so toxic for many reasons.
Yeah. It's such a tough balance because I really respect the fact that doctors have gone through intense training for so many years. But there are times where I show up to a doctor's office and I've seen them Google my disability right in front of me, which is a reminder that you don't know everything. And most of the time, they haven't heard of my disability, or they'll do that thing where they're like, "Oh, yeah, I had a patient who had that once. Did you? I don't know if you did, but."
Right. It's like anyone could say that.
Yeah, exactly. And so I like to feel like my doctor is more my partner in conversation and not that they already assume that they know everything that there is to know, especially because chances are you don't when it comes to my disability because it's not some standard run-of-the-mill diagnosis.
Absolutely. I would say I've never met someone with Larsen syndrome before.
And now you have.
Well, now I have. I know. Thank you for that opportunity. And you've done so much like education work already. Like as a disability advocate, I feel like the primary responsibility is to teach. And like with teaching comes all of this patience and diplomacy and making knowledge accessible, because I feel like another piece of healthcare and medical education is it's that high bar of expectation, but it's also like, why can't you keep up? Or, like, why isn't this making sense to you? And that's it, kind of inherently ableist already.
Yeah, I've seen so much dialogue around, first of all, the lack of disabled medical professionals or the lack of openly disabled medical professionals, and then also recognizing that that's due in large part to the demanding environment. And I understand that you want people who are well trained and capable caretakers, but at the same time, I think there's a way to do that work while still honoring your mind and your body. And I don't feel like the medical profession has caught up to that understanding yet.
Absolutely. It's like, why doesn't having a disabled healthcare provider overlap with being capable, empathetic, understanding? If anything, they're even more qualified because of their life experiences. And, I think things are starting to move in a better direction. I've started to network. There's a national group called the Medical Students with Disability and Chronic Illness. They're small but mighty. I've started going to their monthly meetings, and they would actually love to have you as a speaker. I like name dropped you that I like might be interviewing you, and they were like, oh my God. And there's pilot programs for like disability medicine and anti-ableism curriculums into medical schools. It's still in the research phase, like people are publishing their data, contributing to the academic literature, but it's definitely a movement that has started. So I'm encouraged and also excited to be a part of it,
Yeah, it's a good place to be right now in medicine. I think that as much as these conversations are in their infancy in so many ways, it's just a reminder that we've actually been doing this all backwards because disability is so relevant to every part of humanity. And we should have been having these conversations as medical practices were being developed, I don't know, thousands and thousands of years ago. But instead, we were just like, nah, we're going to talk about normalizing human minds and human bodies. And we're going to ignore the fact that variation is not necessarily something that always needs to be cured or needs to be fixed. And we're going to assume that we are the experts and that our patients don't know what they're talking about. And so it just feels like we're doing everything a little bit in the reverse order now, where doctors are sort of realizing, oh, right, actually, we should talk about this and we should learn about this first, and then we should treat people.
Yes. And that's kind of how it started for me on a personal level. Like once I started really having a practice and not having to focus on training and passing my tests and all that, so many people that I worked with were like, oh my gosh, I feel like you're actually listening to me. Or like, can you believe, this one doctor just like didn't like acknowledge what I was saying, or like he was talking about something that I didn't care about or I didn't understand. It happens so often that people will tell me this, and it just every time it crushes me a little bit, but every time I also say like, I'm glad that we met, like I'm glad that you feel like we can connect and work together. Because I, like you said before, like I tell my patients that I work for them, I'm here to help them navigate these decisions, but ultimately they're my boss. And I wish more healthcare providers approached this responsibility with that outlook.
Especially when it comes to physical medicine and pain management. I know that I sometimes have a hard time articulating exactly what's going on in my body, but I know that I want to talk about it and sort it out. And when a doctor really takes the time to sit with me and have a conversation about it and say, I hear you, and maybe I don't have the perfect solution right now, but let's find a solution together, that makes such a huge difference. And it's also an interesting position to be in because not everything that goes on in my body in particular is fully treatable. But half the battle for me is just to have somebody hear me, just to have somebody say, this is valid, and maybe we can't fix it, and maybe we can't fully solve it. And I don't want to fix you, but I do want to help you manage your problem.
I love that. Okay, yes, we are getting a little sidetracked, but I'm really
That's
glad
okay.
that we
I
just
love these questions. I mean, I could talk about it all day. So just
Same
hit
here.
me with whatever you got.
And that was just part 1 of our conversation with Emily Ladau. If you want to hear more conversations like this, hit that like button. And tune in for the next part of our chat where Emily shares what she wishes more interviewers would ask her. Subscribe to Disability Clinic and hit the bell icon to get notified when the next video drops. In the meantime, please check out Emily's new book, plus even more great content by her and featuring her. It's all linked down in the description below. Until next time, thank you for watching, listening, and learning.
How do you usually introduce yourself to people who don't know anything about you?
Well, first I like to make a joke that I'm, oh, go figure, rude
That you're
phone.
getting a phone call.
Rude phone. Sometimes I like to get phone calls.